Good morning everyone, I am Dr. Shreya Shashi and the topic of my paper is Vascular Anatomical Variants of Abdominal Vessels on Computed Tomography with its clinical significance. Vascular anatomic variants are quite common in general population. Evaluation of the arteries arising from the abdominal aorta and its variation is very important for minimally invasive or laparoscopic surgery as well as for few abdominal disorders. The use of contrast-enhanced computed tomography or CT angiography plays a very crucial role in the assessment of various vascular anatomy. It helps in preoperative evaluation to plan laparoscopic surgery, which allows limited visualization during surgery. It also helps to avoid various intraoperative problems that may arise due to rare variants. So my study was aimed to evaluate different vascular variants on CT, its prevalence and its clinical significance. It is a time-bound observational study done over a duration of 4 months from June 2023 to September 2023, which included 70 patients. CT scan was done using 128 slice CT after contrast administration. All the patients referred to Department of Radiology, MGM Aurangabad for contrast-enhanced CT of abdomen and pelvis were included. Plain scan was not included and creatinine more than 1.6 was also not included in my study. So, out of 70 patients, a total of 27, that is 39 patients had vascular variants and 61 patients did not have any vascular variations. Out of the vascular variations, renal artery variations constituted the most common category, amounting to 17%. Next was hepatic artery variation seen in 11.4%, followed by celiac trunk origin variation seen in 4.2%, and portal vein and nutcracker syndrome seen in 2.8%. Out of the renal artery variations, unilateral accessory renal artery was the most common, seen in 9 cases, and bilateral renal accessory artery was also seen. Among the hepatic artery variations, replaced right hepatic artery having origin from SMA was seen in 6 patients, and common hepatic artery origin from SMA was seen in 2 patients. So, in renal artery variations, the most common was accessory, in which unilateral accessory renal artery was most common. The importance is mainly in case of inferior polar accessory artery because it can cause extrinsic compression of ureter and lead to hydronephrosis. Also, its ligation during any intervention can lead to ischemic damage. Other variations include early branching of the renal artery. It is said when it is said to branch within 2 cm of origin. Like in this image, we can see right accessory renal artery. Also in this reconstituted image, we can see accessory renal artery on right side. This is a case of bilateral accessory renal artery, supplying two arteries supplying both the kidneys. Hepatic artery variations. Normally, the celiac trunk branches into left gastric, splenic, and common hepatic. The common hepatic gives a gastroduodenal branch and continues as proper hepatic. The proper hepatic artery then divides into right and left branch, and the cystic artery originates from the right branch. So, in my study, replaced right hepatic artery having origin from SMA rather than having origin from celiac trunk was seen, and also common hepatic artery origin from SMA was seen. The other variations of hepatic artery includes replaced left hepatic artery having origin from left gastric artery and accessory right or left hepatic artery. Also, common hepatic artery origin from aorta can be seen. This holds importance mainly in case of liver transplant. Celiac trunk variations. The most common celiac trunk variation seen was celiaco-mesenteric trunk. Here, the celiac trunk and the SMA has a common origin from the aorta. Here also we can see the celiac trunk and the SMA having a common origin. Other variations of the celiac trunk that can be seen includes splenohepatic trunk, posterior-superior pancreatico-duodenal artery, gastrosplenic trunk, hepatogastric trunk, hepatosplenomesenteric trunk, and the splenomesenteric trunk. Portal vein variations. The portal vein normally divides into left and right branch, and the right further divides into right anterior and right posterior. But in case of variation, trifurcation can be seen in which the portal vein directly divides into right anterior, right posterior, and left portal vein. The other, in this image also we can see the trifurcation of the portal vein. The other variations include the right posterior originating as the first branch from the portal vein. Also, right anterior can be seen originating from the left posterior, left portal vein. There can be absence of portal vein bifurcation in which there is one right portal branch which travels to the left side from segment 8. The portal vein variations is particularly important in case of liver surgery, radiological interventional procedures like embolization, living donor transplantation or complex hepatectomy. Nutcracker syndrome mainly consists of anterior nutcracker syndrome and the posterior nutcracker syndrome. Anterior is classical, which is occurring because of the narrow angle between SMA and the aorta. The posterior nutcracker syndrome is rare, and it is mainly seen because of a retroaortic renal left renal vein, or in case of circumaortic renal vein, the retroaortic part is compressed between the aorta and the vertebra. It leads to renal venous hypertension and finally breakage of the renal veins, leading to hematuria. So to conclude, vascular variation is quite common in population, and it is most commonly seen involving the renal arteries. The knowledge of these variations is extremely important in pre-operative situations, and some situations can also lead to vascular diseases. Precise vascular anatomical knowledge is very important for minimally invasive or laparoscopic surgery. Although DSA is the gold standard for vascular studies, since it is invasive, contrast CT scan is preferred to study vascular anatomical variations. These were the references that I used. Thank you.
Good presentation. I just wanted to ask, this must be all incidental pickups, na?
Sir,
Nobody must have done a CT abdomen to study.
Sir.
Means for some other reason CT is
Yes,
done,
sir.
and you picked it up.
Yes, sir.
One more question. This renal liver transplant, is there a rule that a CT has to be done prior to a liver transplant?
Sir,
ऐसा कुछ है?
Sir, in order to see the vascular variations, we need to because segmental liver transplant is done, so we need to see the origin of
So
the
they do
vessels.
always write before a surgeon does write to you all, or it's not a mandatory thing?
Sir, it's not.
Ajay?
To answer your question, Rajesh, yeah, it is mandatory nowadays. Most of the donors as well as recipients cannot undergo angio because they are already compromised. But the donors do, it's a protocol nowadays, especially for renal, because as he has shown beautifully the variations, the renal artery variations. Tell me one thing, did you see any complications or as far as the vascular variations were concerned?
Sir, in my study, complications were not seen, but it has clinical significance.
So all of these were incidental detections,
sir, yes,
right?
sir, yes.
So, for example, there was a renal artery duplication. Were these patients hypertensive or young patients or anything related to that, or it was just nothing? Like
Sir, it was incidental. In my case, it was not related to hypertension or like that.
Even that liver, the artery directly coming from aorta, does it have any clinical significance or no?
Sir, it will not lead to any symptom at present, but in case of any surgery or
Surgery,
anything,
they need to know the
they
anatomy
need to
and
know because
roadmap.
it can lead to ischemic damage if we don't know.
Nice.